COVID-19 cases are surging in the United States and Europe as the Omicron variant poses a new threat. Hello, I'm Anand Naidu, and this is The Heat. With its COVID-19 death toll now well past 800,000, the United States is facing another tough winter as it battles the deadly disease. Cases of the Omicron variant are surging across the country, with numbers climbing from coast to coast. President Biden is set to confront the issue in a Tuesday address. Meanwhile, countries like the United Kingdom are seeing a spike in new cases too, and some European countries are introducing new restrictions. Here in the United States, as people start traveling for the holiday season, COVID-19 is also on their minds. We begin with this report from CGTN's Caroline Malone, who is at the Reagan National Airport.
Well, here at Washington, D.C.'s Reagan Airport, there are plenty of people that are choosing to travel despite the risk from the Omicron variant that is spreading across the U.S. and the world right now. In fact, TSA data shows that something like 2 million people are traveling every day through airports. That's double the number of people that were traveling last year. Plenty more people also traveling by road and train. And there are mixed views from people. Even though they are traveling, some are concerned about COVID and others not so much.
We are going to Disney World, Team Fernandez, every year. Never miss it, even during COVID.
Really? Wow. So you went last year as well?
Indeed, we did.
So I guess that means, are you worried about coronavirus right now?
Not in the slightest.
Okay.
You know, we have some vaccinated folks, and which way, we just got to keep living life.
I've had my 3 shots, and I have my mask. I just took it down for this interview. And I'll be careful. I won't be associating. It's going to be a family thing, so I'm sure that there won't be any extraneous people visiting.
Well, health officials are certainly warning that people need to get vaccinated. A stark warning has come out from the NIH that unvaccinated people are at 20 times greater risk of dying from COVID than people who've had the booster. And we've heard that Moderna, one of the booster manufacturers, has actually come out with its latest data saying that it does protect, it does increase antibodies against the Omicron variant. So that's certainly one option, as well as Pfizer. We've also heard from White House officials that really that is the best option for people to protect themselves right now. Well, a number of senators have actually caught the coronavirus recently, and that's despite the fact that they have been vaccinated and boosted. So there is still a risk of catching particularly these later strains, even for people who've been vaccinated, even though that does reduce the risk somewhat. The White House have been meeting today, the coronavirus task force, and President Biden is due to give another national message on Tuesday. Caroline Malone, CGTN at Reagan Airport.
To discuss all of this, joining me now is Peter Chin Hong. He is a professor of medicine and an infectious diseases specialist at the University of California, San Francisco. With us too is Chris Smith. He is a consultant clinical virologist at the University of Cambridge. Also from the United Kingdom, we are joined by Julian Tang. He is a consultant virologist at Leicester Royal Infirmary. And here in Washington, D.C., also with us is Joseph Williams. He is a former senior news editor for U.S. News and World Report. Welcome to all of you to the show. Peter Chin Hong, let's start in the United States. Cases of Omicron are surging across the country. In fact, New York is reporting record infection rates for 3 days in a row. How serious are these reports that we could see what's being described as a viral wave of infections in the next few weeks?
These are very serious, incredible reports, and I think that we're not only worried about a run on hospital beds, because even though fewer people may end up going to the hospital, when you think about how many people are going to get infected, even a small proportion is probably going to stretch our hospitals to the limits, as we're seeing in some areas. The second point that I'm really concerned about is that all these people isolating at homes, from government services, for restaurants, businesses, and most importantly, healthcare, will certainly leave a lot of mayhem and confusion going around.
Now, Peter, are many of these people being infected, many of the people who are vaccinated being infected?
Yes, people who are vaccinated are not escaping infection with Omicron. We assume that much of the surge is driven by Omicron. although nominally Delta is still the main virus in town, I think that estimate will quickly be overturned. But again, boosters have been met by a very tepid and lukewarm reception by the US, even from vaccinated people. So I think that's part of the problem as well.
Okay, let's go to Julian Tang. Julian, the United Kingdom has a high vaccination rate, but it too is dealing with a COVID surge right now. In fact, on Monday, it reported the second highest daily rate of COVID cases on record. How dire is the situation in the UK, and how is the government responding?
Yeah, so at the moment, the main concern is that these increasing number of cases may overwhelm the NHS going into Christmas and New Year. The virus is traveling much faster through the population, even though it may be slightly less severe. The sheer numbers may be a problem for the NHS service to deal with. And the government's holding back on imposing more restrictive measures, much to the dismay of a lot of public health physicians, including myself. I think they're more concerned about the economy and hospitality being hit, which is tragic coming up to Christmas and New Year.
So at the moment, Julian, are hospitals coping?
They are just at the moment. In fact, a lot of hospitals say they're already overwhelmed, but that's not just from COVID. There are other medical issues, related to the cold winter months every season. But add to that COVID plus, the return of other respiratory viruses. I think we're very close to being overwhelmed in the next few weeks if things aren't mitigated from the transmission point of view.
Right. Chris Smith, looking at the bigger picture here, the World Health Organization is warning that Omicron spreads at a rate that doubles every 1.5 to 3 days and is very contagious. We've been told that several times. Are we going to see an explosion of cases across the globe, and will Omicron become the dominant strain?
It's like Groundhog Day, isn't it?
Yeah.
Although I haven't quite reached the stage where Tom Hanks takes the toaster into the bath with him just to end the nightmare, but it is beginning to feel a bit like that. It's like being back in March 2020 all over again. And the reason for that is in March 2020, the whole thing took off very, very quickly across the world from Wuhan in January 2020 because everyone was susceptible and everybody gave it to everybody else pretty efficiently, or started to. Then as the immunity crept in and vaccines began to bite and other measures were put in place, we've held it in check to a certain extent. But here we are with a variant that has the ability to swerve around that pre-existing immunity, which means that pretty much everyone's susceptible again. And while they may not become severely unwell, they're certainly susceptible, they can certainly catch it, and you've got a virus that appears not just to transmit with the dynamics of the original virus, but as one politician dubbed it, that virus on steroids. This one actually goes faster. It makes people more infectious, so it probably increases the amount of virus they make. It seems to transmit very efficiently, and it's got the whole world population to play with again, vaccinated or not. So it's a big challenge and a big threat for that reason. The mitigation is, of course, that it does appear to be a milder illness in those that are catching it, and we don't yet know how severe the manifestations will be in, say, a heavily vaccinated population like the UK, with strong emphasis on boosting, especially in older, more vulnerable populations. It may well be that actually that protection will be very, very good against severe disease, and we're just going to have cases but no consequences. But as yet, no one's got a time machine, no one's got a crystal ball. We don't know.
So, Chris, when you say that this is a variant that is able to swerve around current vaccine immunity, does that mean ultimately we're going to need a different kind of vaccine?
Well, for a number of months, actually, vaccinologists, immunologists, infectious diseases specialists have been talking about the whole question of COVID vaccine 2.0. And the idea is, can we come up with something that either better reflects the direction of travel or evolution of the virus, or better still, can actually outflank the virus's evolution and provide comprehensive cover, not just against these variants, but threats unknown and undiscovered as yet, a pan-coronavirus vaccine. That's not so unlikely, and it may well be possible to do this, but it does take time. We're not there yet. So what we do have in our hands at the moment is a technology, a proven technology, and a technology that's relatively easy to update. So conversations are already being had about how we update the existing vaccines to better reflect the variants that are circulating. But looking further into the future, the aim will be to come up with a more comprehensive, more future-proof, if you like, vaccine against the coronaviruses and as a family, but we don't have that yet.
Joseph Williams, President Biden will address the COVID crisis tomorrow, Tuesday, from the White House. But he has been taking some heat from all sides for not acting quicker on this current surge. Beyond the sort of continued emphasis on vaccinations, what can we expect?
You can expect the president to talk more about personal responsibility, to talk about how vaccines are very important in fighting this virus, about how booster shots are the next great thing that people need to do to bring this thing to heel, but also that people need to understand that this is a fast evolving situation and that this is something that everybody can do if we all pull together as Americans. Now, that has been highly unlikely if we're in a time machine or if we're in this feedback loop, Groundhog Day from 2020, March 2020. We have the tools and we know what we're going through, but the evolution of behavior has not matched the evolution of the virus. We still have way too many people unvaccinated in the United States, way too many people who are unboosted, and we're still working through the kind of sonic boom that happened after the Thanksgiving travel season happened, where infectious cases rose, the Delta variant was still holding sway and still holding court, and we're still trying to grapple with that particular strain of the virus and bring it to the ground, and now we're facing Omicron. So if it is a replay of 2020, only this time President Biden is in the White House. He's the guy in charge and not President Biden. Rather, President Biden is the one in charge, not President Trump. So he is the guy who's bearing the responsibility here, and it's going to be him who people will be looking to for leadership and to use the bully pulpit not only to inspire, but also to get people informed and let them know exactly where the United States is in fighting this virus.
Right, but isn't the biggest challenge for him, Joseph, the fact that there is so much ideological/political resistance to getting the vaccine?
That's exactly right. And he has been fighting essentially with one hand tied behind his back, because while part of the country, almost 50–60%, give or take, is very much behind the president in doing what they need to do to fight the virus and get life back to some semblance of normal, you do have fully a third of the United States public who are either skeptical of vaccine, either are resistant because of political reasons, or resistant because of ideological or religious beliefs that the vaccine is going to be somehow harmful. I heard a doctor talk yesterday about how he is encouraging his patients to get vaccinated, but he doesn't want to force them because they have a right to their own body too. But the problem that's missing in that equation is the greater good here. We know that this vaccine works. We know that while it doesn't prevent all infections, it prevents death, and it is a major, major tool that we didn't have a year ago.
Peter Chin Hong, the number of people in the United States who are fully vaccinated is 61%. In fact, that number goes up to 83% if we count people who've had one shot. But how much impact will the unvaccinated have on the healthcare infrastructure in the country?
They'll have major impact, Anand, because unvaccinated people tend to cluster. So not only in households, which we know, but also in regions. And if you think about the way that public health is administered, it's regional in the US, not national. There's no sort of like national hospital rescue system that goes to fill in the people that need it, but rather regionally it's hurting. For example, in California, you think of it as a liberal state, but there are deep pockets of resistance with low vaccination rates. You take a very little during this window period to overwhelm hospitals with not just COVID, Delta, possibly Omicron, and influenza, other respiratory viruses, and all of a sudden you have a tipping point.
And what about the situation in a place like New York, where we've seen, as I pointed out earlier on, the infection rates going up for 3 days in a row?
I think, again, physical hospital beds are one thing, but when you look at a place like New York, Michigan, New Hampshire, lots of swaths of New England, you're talking about healthcare workers going home, and because of antiquated sort of like non-diagnostic tests, ways that we isolate after infection, whether or not you're vaccinated or not, you're talking about a prison sentence of 10 days for everybody who's positive.
Julian Tang, Chris Smith was talking earlier on about the severity of the Omicron variant. There is some data from South Africa where this variant was first detected to suggest Omicron is milder in severity. But since then, UK epidemiologists, in fact, have found no evidence to confirm this. What are we learning about this variant?
Yeah, so that's quite complex. The South African data is really based on a real-world population study. The UK modelling approaches, the London School model assumed that it was the same severity as Delta in their model. And the Imperial College, in a very limited data set, suggested that it was no more severe than Delta. But again, we have to wait to see how that pans out with a larger population of infecteds, hospitalizations, and deaths. My own personal view is that this virus is probably less severe than Delta, but the large numbers of those getting infected may, even if the symptoms are milder, still end up with hospitalizations just because of the huge number of people getting infected. But we'll have to wait and see, and the booster rollout hopefully will try to mitigate some of that hospitalization rate as well.
Chris Smith, you are in contact with scientists in South Africa. What is your assessment of the severity of Omicron, or do we still need a lot more comprehensive data before we know what it can do?
One is always very cautious about taking data from one geography and one demography, one very different population, and mapping that onto a totally different area of the world, because you can get caught out that way. But South African science is absolutely A1, and they are approaching this with enormous rigor. What they're finding is that there are fewer people ending up in hospital, fewer people ending up in hospital with severe disease, on oxygen or in ITU, compared with Delta. The trajectory of rates of admission to hospital compared with similar numbers of cases when they were battling Delta do argue this is a less severe disease. But one has to be cautious, because this is a country where they've seen 270,000 excess mortality and climbing from COVID hitherto. So they've already got a very exposed population with reasonable vaccination rates in some sectors of society, and therefore some degree of underlying immunity acquired through natural infection as well. And it may be that they're being partially protected by that pre-existing exposure, vaccination, and the fact that the virus, and it sounds like an awful term, but the virus has already harvested perhaps some people who would have been victims otherwise. So it may be you're looking at a survivor population. But looking on the bright side, that may not be the case, and there's quite good evidence to suggest this is a mild illness. But as we've just been hearing from Julian, it's a numbers game. And if you've got something which is half the mortality rate, it might be 25% lower mortality, but let's say it's half, it nevertheless can spread, say, twice as quickly, despite being much less lethal. Because it gets to so many more people so quickly, it still has the potentially destructive to healthcare services, because it overwhelms our ability to do healthcare. Not just because lots of patients turn up at the door of the hospital, but also because doctors, nurses, other healthcare workers, if they get infected, even trivially, can't go to work. And we've just been hearing you end up with this 10-day prison sentence, you're in isolation, you can't actually contribute meaningfully to work. You can't possibly, as a doctor, really work from home.
Right.
So as a result, this robs the healthcare service of very important pairs of hands. And that's really where COVID can be very disruptive indeed, not through causing illness, but through depriving a service of skilled pairs of hands.
And one other point, Chris, and that is, governments are introducing mitigation measures, or reintroducing, I should say. I mean, we have the Netherlands, for instance, just announced a lockdown, but we're also seeing a lot of opposition to that, opposition to the use of masks, opposition to lockdowns. There have been some pretty big demonstrations in the Netherlands as well. Is it going to become increasingly difficult to enforce these measures?
I think people are becoming fatigued with the measures. And when there is no demonstrable threat, which in the past there was enormous uncertainty, there was great fear, and then there was the UK Prime Minister in intensive care. And this galvanised people, it focused their minds, we need to make sure we get behind these measures. This has gone on for 2 years, and people are increasingly seeing livelihoods going down the drain, emotional well-being going down the drain, Christmas going down the drain, and as a result, people are saying the pill is now worse than the ill, and I don't want to go along with this anymore. So keeping people on side is becoming a harder and harder ask, and this is the reason why I think the UK government, as one example, have actually said we're not going to introduce more measures yet, but it remains a possibility. And I suspect they may do more things after Christmas, because I think they reason that the public psychology wouldn't take it. Other countries in Europe, though, in contrast, they were already dealing with a really big surge of Delta. And you may recall talking on this programme about big surges in Delta that were happening in Europe.
Right.
But the UK already had high caseload, but was not seeing consequences of that. So those European countries were already introducing various measures. This is just a step further for them. So it's less of a psychological dent than in the UK, going from relative freedom and normality to near lockdown. And that's what's got people agitated.
Joseph Williams, if we look at the trend in the United States of infections and the number of deaths, 800,000 deaths right now, and I know this is an awful thing to contemplate, but it's probably going to reach 1 million deaths next year. President Biden has been responding to COVID for almost a year as president. How much is at stake for him, with the country getting to that death toll of 1 million people?
It's not a good look for any leader, particularly not this one, who came into office promising that he would get this virus under control. Now, mind you, the virus had been raging for almost a year by the time Biden took office, and his predecessor had kind of made a campaign out of minimizing the virus, even though he himself got sick. As Boris Johnson was intensive care, we had President Trump, who was near intensive care, who actually probably wasn't intensive care, but was far sicker than anyone wanted to let on. So no one wants this virus to be over more than Joe Biden, but at the same time, he's got this population that is suffering from fatigue, that doesn't want to have livelihood spoiled, and that the economy, one of his calling cards and one of the determinants of whether or not his party will leave control of Congress next year is very much on the line. We've talked about the fact that the virus gets the last word, particularly with all of this, with politics, with the economy, with people's lifestyles. The virus is in control, but until that virus is taken out of control, he's got a lot riding on whether or not this pandemic gets resolved by the time he is up for re-election and by the time his party has to face the voters by next year. It's a very, very tall order, and one that many people doubt any world leader would be able to execute. Nevertheless, one where half the population is very much against doing common sense proposals that would help us get back to some semblance of normal.
Peter, as Joseph says, no one wants this pandemic to end more than the president himself. But do you see the United States making any kind of serious progress in getting this pandemic under control in the year ahead?
Well, I agree with Joseph that ultimately it doesn't depend on what a politician may do. Ultimately, the virus will decide what it will do. And some pundits think that, maybe this is the way the pandemic will end. Maybe you'll get a very transmissible variant. You'll have increasing waves of population immunity, and it will peter out. After all, pandemics go on forever. The 1918 pandemic with influenza fizzled out for both of these reasons. But the president can minimize damage by encouraging the people to, use these additional measures. We don't only have, vaccines available. We have more diagnostic at-home testing, although they are more short supply now. We have a pill that's probably going to be FDA approved, or a couple of them, maybe molnupiravir from Merck, as well as Paxlovid from Pfizer, that may appeal to the constituents who are not in favor of getting a vaccine. We have long-acting monoclonal antibodies. So I think with all of these tools, maybe we can dampen the death toll that's certainly about to rise, like you said, Anand, to over 1 million.
Julian Tang, here in the United States, the country's prominent infectious diseases expert, Dr. Anthony Fauci, says the United States needs to, in his words, flood the system with testing. What are your thoughts on the testing system right now, and should there be a lot more emphasis on home tests?
Yeah, testing, I think, should take second place to actually vaccination and boosters. I think if you vaccinate everybody, we often don't test post-vaccine for responses. We don't test pre-vaccine for infection. I think if you're going to have that jab, have that visit, I'd rather see them get vaccines and boosters into people's arms rather than taking a sample, see whether they're infected or not, because the test will just tell you that you're at that point positive or negative. If you're positive, you get infected. Natural immunity is not completely protective against Omicron. We know that boosters will help with that as well. If you're negative, it means you're susceptible. You need the vaccine and or a booster anyway against Omicron. So I'd rather emphasize the vaccine and booster rather than the testing at this point, if you have to have one visit with one jab as such.
Chris Smith, I mean, what is your outlook for COVID for the coming year? I mean, given that, we've seen the Delta variant, now the Omicron variant, is it inevitable that there's going to be other variants in the months ahead?
I remain optimistic, to be perfectly honest with you, because I think we're beginning to see a number of measures coming along now that will actually help us to protect the people that this is all about. Because when Boris Johnson, Prime Minister of the UK, gave the instruction to our vaccine task force to go and source vaccines, his instruction was, we need to stop people dying. Now that's the critical wording, isn't it? Stop people dying. Not we need to stop the virus, we need to prevent cases. We accept that this is an endemicized virus. It will continue to circulate. So the emphasis needs to be on minimizing the harm it does to us. And vaccines, therefore, remain one mainstay of that, but not the whole show. They're not the only show in town, because what we now see, as has already been referenced in the programme, antiviral drugs coming along, including some repurposed agents and some invented de novo. And, for example, Pfizer's Paxlovid, which is still awaiting regulatory approval in most jurisdictions, this offers an opportunity now to target treatment to people who are the most vulnerable, who might otherwise end up in hospital, and keep them out of hospital. And now we're in a position to do that. It does mean that we can afford to take bigger risks. We can afford to say, well, no, we're not going to shut whole countries. We're not going to crucify economies because of an outbreak of something which, when controlled with these sorts of measures, poses a smaller threat than flu. We don't shut the economy for flu. We don't shut the country for flu. We don't ban international travel for flu. Perhaps we should, but we don't. And in this way, we look at this as something which we control in the future. And I think we're beginning to see now the tools being handed to us to let us do that.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. I'm Anand Naidu. Thanks for watching.